Welcome to the final episode of Rural Health Pulse Season 2. I'm your host, Dr. Jim Kinnear, and this episode will take a final look back at the highlights and presentations from the Pennsylvania Mountains Rural Health Conference held November 6, 2023 at IUP. At the conference, over 200 participants gathered to learn and exchange ideas about rural healthcare. In this episode, our main focus will be learning about new healthcare technologies, such as the use of drones in medical settings. Our first two guests today are Alice Griffith and Erica Tamburo, the director and proposal writer for Airspace Link. In their presentation, Griffith and Tamburo showcased how drones can be used to improve healthcare and how they can be used to map rural Pennsylvania areas. So to start off, would you please just introduce yourselves a little bit and your role? So I can start with you, Alice?
Sure. Hi, my name's Alice Griffith. I am a director of business development for a company called Airspace Link. Airspace Link is a company working to help with the mapping and GIS or geospatial technology for drone infrastructure. And so what that means is we make the maps of the skies. We help figure out where drones fly.
Fantastic. Erica?
Sure. Hi. Thank you for having me. My name is Erica Tamburo. I'm on Alice's team as a proposal writer. I love every minute that I can spend helping drones get into the air, no matter what that may mean to our different partners. So thank you.
Well, thanks both of you for being here. I find this topic just really fascinating, and I'm going to show my age here a little bit. I remember several years back, an announcement came out where Jeff Bezos was saying that the vision for Amazon is they will be delivering packages to people's homes using drones. And I can remember hearing that and initially being very skeptical of like, is this some made up internet rumor? Is this true? Now, of course, today we hear that. We're like, okay, yeah, that sounds good. Where do I sign up? So a lot's changed in a short amount of time. And maybe we could just start there if you'd like to tell us a little bit about Airspace Link and what you do and what has happened in the last couple years in terms of drone technology.
Excellent questions and vision. I might get in trouble for saying this, but Jeff Bezos failed miserably in the world of drones. I'm sorry to say it. Unfortunately, everyone does think about the world of getting their Amazon packages delivered by drone now to their house. Actually, not unfortunately, fortunately, but that probably was because of his vision. But there is so much more that is out there for drones than just package delivery, but it is one of the more complicated use cases for drone technology. My favorite, but not all. What I will say is that outside of just receiving Amazon packages, there's a whole world of training, education, workforce growth, and then there's also a lot of services like infrastructure inspections as far as like rail, bridge, road, a lot of those things that can be done by using a drone instead of having somebody, maybe a team or an individual, go out and spend time in the heat or cold or snow or weather challenging environments and do those inspections in person. There's a lot of ways to use drones to bring like eyes into visual capability, extend where a human can go, and that happens in public safety as well. So there's a lot of operations that are happening with drone technology for those types of things. But to answer your question specifically, I think the big vision right now, and the world has changed greatly, and it is changing greatly as one would do in the midst of kind of a high technology advancement area. But what we've seen over the past 10 years specifically is major growth in the drone industry. I'll give you two statistics. There's almost 1 million drones legally registered in our airspace today in the U.S. There are only 42,000 planned or manned aircraft pilots operating today. You have more than 10x of drones already here, already flying. Are they being monitored of rules and regulations? Are the pilots regulated? Are they educated? Are healthcare systems educated? Are people and communities educated? Like all of this is happening as we speak, and it's hard to visually see all of that. So there's a lot of things that have to fall into place with the FAA and with the air traffic control, with airports, with communities to kind of understand where all this traffic is and help to manage it.
That's very interesting. That statistic really grabs your attention and just kind of giving you the extent of how much drones are being used. And I'll be honest, I think for a lot of lay people, we just think of drones as being something more recreational and something that people use for photography and for fun, possibly to spy on their neighbors, but we don't think of all the commercial applications. So what are like some of them, you highlighted a few of these, but what are the major commercial applications we see of drones?
I could go on to a lot of commercial applications. Erica, do you want to cover this one?
Sure. I don't know the statistics as well as Alice does, but you'll. So some really exciting commercial applications are infrastructure inspections. So there's a lot of companies, like your light companies, electricity companies who use drones to maintain their infrastructure. PA is the land of bridges. So bridge inspections is another really, really important thing that we can take advantage of here in PA. There's agricultural applications. There's first responder applications. On Facebook, every day there's somebody looking for a drone pilot who can help find their dog, somebody's lost dog. So you see a lot of activity there. That one makes me very happy that people are really getting help in time of need. We just met a company from here in PA that does fire response, so they can do the controlled burns with a really cool technology that they've made for their drones, and they're just about in every state. I thought that was so cool, and we don't really hear about stuff like that. New York City uses drones to watch for sharks coming in and out of the bay. Like, who would have thought of that one? So there are so many applications, and more to come. Just once the technology gets out and people get a hold of it and are able to use it and innovate themselves, it'll grow exponentially.
Well, thanks for that overview, and it really is interesting to hear all the creative and innovative uses for drones. In particular, since we're at a rural health conference, what are some of their potential for rural healthcare issues?
With rural healthcare or urban healthcare, the benefits actually kind of are similar. So the majority of the time you have movement of medical items between facilities, between campuses, between healthcare options. So if you have ground couriers that you currently deploy for moving anything around your campus environment or directly to maybe a supply chain or warehouse distribution site, or if you need to move things maybe to some of your partner doctors, physicians, things of that nature, pick up blood samples, run labs, send stats, send pharmaceuticals out. Drones are heavily being used in that capacity all around the world. What's new and what's coming, especially with some of the movement with Walgreens and CVS and some of the other industries outside of even just medical, is the movement of delivery to homes. And so you would have people that are interested in receiving pharmaceuticals at their house. If you think about being sick, most people don't want to leave the house. They might have a telehealth call. And then what if the world existed where right after your telehealth call, a pharmaceutical pill pack or whatever you needed prescription-wise for your specific condition was delivered right to your door instantly? Or if you were mobility challenged, or if you had any type of disability, whether it's temporary or permanent, it's nicer and maybe more convenient for you to have something delivered to your home. But outside of just convenience, there's time. The drones are moving faster typically than a ground car or truck would be doing. Now, this depends on distance. But ultimately, if you're trying to distribute something within a regional area, drones typically are going to be able to move something very fast. So if you need to move something right now within 30 minutes or less, even 5 minutes, 10 minutes, like if we need to send out an AED or an EpiPen, then you might have, rapid response in that environment versus an ambulance or a medical care team. You are also going to see things like CO2 emission reduction. So there's better for the environment aspects with electrification, with vehicles that are using energy in different forms of energy versus like gas or fuel powered or combustion types of vehicles that are really at large scales polluting our world. There's also kind of some side effects to that, which is traffic reduction. And that usually results in traffic accident reduction. So there's some side benefits as well.
That's a great overview of some of the benefits, and definitely heard there from a workforce standpoint, from a time and convenience standpoint, also from a sustainability standpoint in terms of the resources that are needed to deliver that function. So very interesting. What do you see as some of the major barriers to adoption of more use of drone technology, in particular in healthcare?
The biggest barrier is the regulatory environment. Many industries do see that with high innovation and high growth. So we're currently living in what I am calling and what the world in our kind of industry calls a transportation revolution. So much like you had the train and tracks that had to connect and get standardized, or the automobile and the automobile parts and the road systems get developed, you are having to work independently in order to come together where it's a centralized environment. So there are challenges with technology, and there are challenges with regulatory rules and laws really meeting up in the middle. And there's a awareness, I think, too, of who's responsible for what. So we're working through a little bit of that right now. I think over the next 2 to 5 years, we're going to see a great amount of growth in that space because we have about 10 or more arguable years behind our belts now. So we have a pretty good understanding in the drone industry, when I say we, who, what may come and what will now become rapid, more advanced growth.
Thank you for sharing that. As you have an opportunity to do presentations at conferences like this, what kind of reaction do you typically get from an audience after they hear your presentation and get to see the videos that you share of all the different uses of drone technology?
I'm going to start, and then I'll let Erica jump in after this too. So what we just heard from today's session, and then even with other sessions, is my kid has a drone. And I think I know a little bit about what they're doing, but I just learned a little bit more from you. But I'm curious, like, what's their chance of getting a job? Or what do you think that, Erica had actually touched on it, but the salary level of a pilot. There's a lot more out there with workforce development for our younger, generations as they grow up into the space. There is a whole new world coming, which is very exciting. You've got GIS analysis and technicians, you've got pilots, you've got, solders, you've got welders, you've got people that want to build things again. That's what America came from, right? Building all these automobiles. Now you can build aircraft, and we're hoping to bring that back to the U.S. more. But outside of that, we hear a lot of comments on, fear of drones. So I think where most of the conversation goes is, my kid has a drone, but I think it's like a toy drone. Yours seem a lot different. How are they different? We have that question. And I would welcome anybody to, challenge or actually really support anybody's kids that do have drones, because I think that there is a lot of opportunity for them to learn and to play and then to grow and get excited about aviation, because there's a whole big world out there for you to take advantage of. But outside of that, we have the fear of drones. And so I think people, without being educated, and this is normal human nature, naturally fear something flying at their face. Or flying, at their building, or flying around their house or their cars or their environment. It's a scary thing to figure out what that is doing or what that's potentially maybe storing or taking pictures or things of that nature. So we are here today and hopefully continuing to be involved with the community here in Pennsylvania to help educate people on why drones are good and what they can be used for, all these great use cases that we're talking about, and how they can actually help to bring new resources and new services to your organizations, to your communities, and to your lives.
Fantastic. And Erica, Alice covered things really well, but anything you would like to add to that?
I would like to add there are initiatives about the FAA has the drone ID, remote ID, and some people have mixed feelings about remote ID, but I think of it as a license plate, just like you would for your car, because clear communication of what is flying around us and what it's doing will alleviate some of that fear. I have the same fear when I'm in my backyard and I hear it. It's there, and what are they doing? And the whole idea behind that is to start to be able to share this information, let people know what's going on, and our work in the field is also building a system. So, say you are in your backyard or downtown and a drone flies by, and you can hop on and look and see, there's somebody there, they're registered, they have a flight. No personally identifiable information, of course, for security reasons, but just situational awareness. Usually, the times we're scared are just the times when we just don't know what's going on, and if you just simply say, "Hey, this is what I'm out there doing," then the fear goes away. Also creating instances where people can come, touch the technology, learn about the good. if you only got your information from the news, what kind of drones are you going to hear on the news? Not the good not the good kind. And there are just an overwhelming number of positive drone use cases out there that are doing good, that are bringing resources, medication to people in need, that are helping to connect the world more and solve some problems for us that are really important. And just keeping that information, getting that information out there more, and the more people that see it, the more they're excited. I've given a couple of presentations recently, and the response is, I didn't know that drones could do that. I'd never held a drone. Like, look at all of this is really cool. So education is really educating people about what it is so they can accept it, and also educating our younger folks to get them into those pipelines to help then support this blooming field, because drones aren't coming. Drones are here, and they're doing some really fabulous work.
Wow, well said. Thank you so much for sharing those thoughts. And I think, first of all, the next high school career fair, I have a feeling Drone Pilot is going to be one of the most popular booths for people to sign up for, to hear more about. Just want to take this opportunity to thank both of you for spending some time and giving us some highlights and sharing a little information here and educating us more about drones. I learned a lot in the conversation, so thank you so much.
Thank you.
Thanks for having us.
I should ask you, Jim, what's your favorite? What's your use case? Which one would you like?
No. Chris Corrin has been a big advocate of this. Just so you know, she's always talked about drones. Jim, we have to have presentations of drones and do more. One of the departments I supervise is the safety and security, which includes our courier service.
Surveillance is huge. Yeah.
Well, we're the courier piece. As we're doing remote things with tests and getting out, that's a resource thing. So the idea of being able to possibly use it for addressing some of our courier things, especially as a rural health system, we have Indiana Punxsutawney, and we are now exploring a potential partnership to add Armstrong to our network. You have these hospitals that are all 30, 40 miles away. You're running a person maybe for one specimen, that distance, and so the idea of the future of that, not having to use that resource in that way, I think will help rural hospitals to be able to collaborate more. We're looking at potentially IRMC being more of a reference lab for some of the other hospitals, because we have a strength in that area, and drone technology could be a big part of that.
You got it.
Mm-hmm.
That's exactly where it's going,
Yeah,
and that is where it's going to add so much value in healthcare.
Mm-hmm. We're doing a couple highlight clips on just the conference itself, and maybe we might use for promo for next year. So any thoughts you'd like to share on the value of having individuals come together for a conference like this to talk about rural healthcare issues?
Oh, absolutely. I think in-person communication and education is always the most important. I think it always is probably what seals it in your brain more, because I think in-person is just going to naturally provide those things that humans need, where you need the visual, you need the audio, and you need kind of the interaction to sort of, make people really engaged or excited about the topic, whatever you're talking through. I personally have always felt that way, so even though I work remotely in my current day job, I love to be in person. So I love to have events where we get to socialize, meet folks, answer questions, talk real-world use cases like what we just did, understanding where pain points are and where people need to come together and maybe learn from each other. So as far as looking forward, I think the best part about this type of conference is you're bringing together numerous organizations that are all for the same mission, and we get to learn from you, and you get to learn from us.
Fantastic. Thank you so much. Also in this episode, we'll have a chance to talk with Mr. Matthew Capell, Senior Vice President of the Southeast Region of Mainstreet Rural Health. In his presentation, Mr. Capell talks about Mainstreet Health and how they've been able to provide rural communities with affordable, high-quality health care, as well as their plans to expand Mainstreet Health nationwide. Matt, to start, just first of all, I want to thank you for your support of this conference.
Thank you so much. We're very excited to be a sponsor of the conference and of this event, which has been great for us and I think great for Pennsylvania.
Matt, curious if you could just tell us a little bit about Mainstreet Health and what your organization does.
Mainstreet Health is the largest value-based care company in the United States that is focused exclusively on rural communities. So we are active in 20 states currently, and we're adding another 6 states next year. In aggregate, we work with about 900 primary care clinics and are approaching about 500,000 Medicare beneficiaries that are under those clinics. We were originally founded by the former director of innovations for CMS and a rural primary care physician. And their objective, and really our mission as a company, is to help rural primary care practitioners be more financially sustainable and also to help provide better care to what are oftentimes the sickest and the most complex patients that you find out in rural America. And the way we do this is through a pretty unique model that ultimately costs the practice nothing at all. And in fact, we're actually able to pay them a pretty substantial revenue stream above and beyond their fee-for-service revenues today. And core to our model is a role called a health navigator. And this individual is somebody that we at Main Street would recruit and hire from the local community. We put them through pretty rigorous training, and we drop them into the clinic. We pay 100% of their salary, their benefits, and they really act as an extension of that practice's care team. And they have a couple of primary responsibilities, one of which is to help seniors with all kinds of social determinants of health issues. I know that's a buzzword, but what this translates to is seniors are very confused about Medicare and insurance. So we answer a lot of questions about the basics of how an insurance policy works. Lots of questions about affordability of medicines and other things in the healthcare continuum. Our navigators are trained not just to hand someone a pamphlet and walk away, but really to dive in and resolve the issue on behalf of that member. So an example is where we've had a patient who was afraid to admit this to their doctor in their 10 or 20-minute visit, but was able to confide in the health navigator that they had been splitting their pills. We come to find out the reason they're splitting their pills is because they couldn't afford the copay and they wanted to make that medicine last longer. We've also had issues where a member is unable to pay for certain services, even things like heating in the home where they might have heating issues, inability to afford utilities. The navigator will step in to resolve those issues. We'll even resolve secondary issues where we've had patients who maybe are unable to take medicine because they've been sharing it with their sibling because their sibling is uninsured. And so the way we'd solve that problem is to go and get that sibling enrolled in Medicaid, and therefore both of them now have coverage sufficient for their needs. And the second part of the responsibilities for the health navigator are really what are called quality activities. And so this is a lot of preventive medicine that has become quite common, but is often a big burden on staff at the clinic who is busy seeing patients and scheduling and answering the phones. They don't have time to chase a list of people for coming in for A1C measurements, controlling hypertension, diabetes, chronic kidney disease, pre-screenings for colorectal cancer, breast cancer. And so this navigator is there to help support the clinic staff to bring those patients in for those preventive screenings, which ultimately leads to better outcomes and better efficiency in the system. And so it's been a model that's been working very, very well. We focus on both original Medicare patients and also on Medicare Advantage patients, and we're also exploring some new patient populations as a company.
Thanks for sharing that. That was all really interesting information. And as you were speaking, a few things that was coming to mind to me is I think healthcare is often criticized for, one, being fragmented, and two, for being complex. And that seems to be two key issues that your organization is helping to address in different ways.
Absolutely. We try to work directly with the patients in the clinic, and that's key, is our navigators are there in person 5 days a week at the clinic, and they meet these patients, they get to know these patients, they get to know how that practice functions. And some of the areas where they can really connect the dots are things like referrals to specialists. That continues to be a very clunky process in American healthcare of moving patient records back and forth between that specialist. Oftentimes the specialist does not send anything back. Another great example is transitions of care. We've made pretty tremendous investments in technology such that we have technology that will help surface when a patient is admitted or discharged from a hospital. not even just the local hospital, it could be across the country. And so we're able to quickly identify those situations, reach out to the family, reach out to the patient to make sure everything's okay and make sure they understand their discharge plan, and also schedule a return visit into the primary care provider so we can keep that continuity intact.
That's fantastic. And thinking of what your company does, can see the benefits to the healthcare providers in helping to manage some of these issues, but the ultimate benefit to the patient of having more comprehensive care, more holistic, and ideally better outcomes as a result of that.
That's right. I think what we love about our model, and obviously we're biased, is that it brings the patient into the value-based care equation. There are other arrangements out there where you have a company far, far away that's asking you to go chase down A1Cs or chase down blood pressure readings, but we're really bringing the patient into the forefront, into the center of this effort, so that ultimately you can drive better patient satisfaction, better outcomes, and the financial benefit to the practice can actually be pretty substantial as well.
Right. Well, thank you for enlightening us on Mainstreet Health and some of the services that you provide, and thank you again for your support of this event.
Thanks for having me.
And that concludes today's episode and Season 2 of Rural Health Pulse. In the last 3 episodes, we've brought you some highlights of the 2023 Pennsylvania Mountains Rural Health Conference at IUP. The 2024 conference is rapidly approaching, and it will be held on Thursday, November 21st at Indiana University of Pennsylvania. Please visit the conference website at pmrhc.org for more information. I am Dr. Jim Kinnear, and thanks for listening to today's Rural Health Pulse.